Why is there no single test for Parkinson's? Parkinson's disease is a complex condition, and diagnosing it is not straightforward. There isn't a single test that can definitively confirm Parkinson's disease. Instead, healthcare professionals relying on a combination of clinical evaluations and patient history. The diagnosis is primarily based on observing specific motor symptoms. The most notable of these is bradykinesia, which means slowness of movement. Other key signs include resting tremors, rigidity, and postural instability. These symptoms are assessed during a thorough neurological examination by a specialist, often a neurologist who focuses on movement disorders. One reason for the lack of a single test is the complexity and variability of symptoms. Parkinson's disease can share symptoms with other neurological conditions that cause similar movement issues. These include progressive supranuclear palsy, multiple system atrophy, and vascular Parkinsonism. Because symptoms can vary widely among individuals, especially in the early stages, relying on one test would not be effective. Another factor is the absence of a specific biomarker. Currently, there is no widely accepted blood test, cerebrospinal fluid test, or imaging study that can definitively confirm Parkinson's disease. While tests like the dopamine transporter scan can indicate the loss of dopamine nerve endings in the brain, this finding is not exclusive to Parkinson's. It can also appear in other Parkinsonian syndromes, meaning these tests can support a diagnosis but cannot confirm it on their own. The diagnostic criteria for Parkinson's disease, as recognized internationally, depend on clinical features and the exclusion of other conditions. This means that doctors look for specific signs and symptoms over time, often observing how a patient responds to Parkinson's medications. This process can take time and requires careful monitoring. Additionally, tests like magnetic resonance imaging or dopamine transporter scans are primarily used to rule out other diseases that might mimic Parkinson's. They help support the clinical impression but do not replace the need for a thorough clinical diagnosis. Ongoing research aims to identify reliable biomarkers that could simplify the diagnosis process. Some studies are exploring tests on cerebrospinal fluid and skin biopsies, but these are still in the evaluation stage and are not yet standard practice. In practice, diagnosing Parkinson's disease is a careful process that combines clinical expertise with supportive tests. This approach reflects the current scientific understanding and guidelines from major health authorities. For individuals suspected of having Parkinson's, specialists often follow them over time to confirm the diagnosis and tailor treatment accordingly. From the perspective of Parkinson's disease, the complexity of its symptoms and their overlap with other disorders necessitate this nuanced approach. This ensures that the diagnosis is as accurate as possible, guiding effective management and care. It is essential for anyone experiencing symptoms to consult healthcare professionals for personalized advice and assessment.